Hi, this is Ernie Schmidt with Palo Alto Therapy, and I want to talk with you today about feedback-informed treatment. So this is something that we do here at Palo Alto Therapy and something that I would like to see all therapists do a lot more. Right now, it sounds like only about 2% of therapists are incorporating this type of feedback into their therapy. And just to give you a brief overview of what that is, it's a pretty simple process, actually. It's just a matter of having us have an open dialogue with our clients about how they're doing mental health wise, emotional wise, some sort of tracking system of that. And then in addition to that, also an open dialogue and open communication about how they're feeling about the therapy they're receiving. So it's kind of as simple as like a survey that you do, but we have a system here that's a bit more, electronic, and it's through like a tablet, but there's all types of this. It's really just, having someone indicate, where they are feeling on a certain range, let's say depression, anxiety, kind of quality of life. And so that's an important part of this process is analyzing how you're doing. So we know, are you making progress? Are you not making progress? Are you stalled in your progress? So that's a really important feature for clients and for us as their therapist to really be assessing your progress and your treatment improvements, treatment goals. And then in addition to that is also feedback about, hey, how did you like today's session? And not everybody can do that in a real upfront way. I know certain people are more shy than others or just culturally inappropriate to maybe be criticizing your therapist. So we have a method of ability for you to be able to do that in a paper, digital format. And then our therapists are pretty well trained in trying to help you have an open dialogue about that and letting you know that it's totally okay to talk about what you liked and didn't like about the session or about treatment in general. And we find that's incredibly important for making sure you're getting what you want out of therapy. And the research backs us up too. This is something that really is solid in terms of feedback-informed therapy. The results are much better for therapists and for clients, that they actually get more out of their therapy and that therapists can then make the right adjustments to meet their needs better and also make more progress in terms of the treatment goals and all those things that we want to see. So not only do we want to see, faster results and helping you reach your goals and feeling better, but we also want to see that our relationship with you is really solid and that you're getting your needs met and that we're connected in that way. Without you leaving, disappointed and never having a way to share that with us about what we can do differently or how we might have said something that rubbed you the wrong way or that kind of thing. Just wanted to give you this quick little video about feedback-informed treatment. It's something that we really believe in at Palo Alto Therapy. The research is awesome when it comes to these things, and it's a big part of us being evidence-based. Not everything in therapy can be completely science and completely measured, but this is one thing that we really make sure that we do well. And we try to also use other steps and other processes that are evidence-based to incorporate into treatment to try to make it as efficient, as effective as possible. We know it takes a little bit of effort for every client to have to rate us all the time, but there's a real reason we do that. And it's in the end is to help you faster and better and make it a great experience. So hopefully you enjoyed that. If there's any questions or comments, you can always check in with our care coordination team and they can explain more, or your therapist. Thank you.